So they serve different purposes, and I think that it's pretty common these days for us to get that question, especially when women would prefer to not have breast compression associated with mammography. But the ultrasound and MRI can show some things that mammography cannot. On the other hand, mammography can show some things that breast ultrasound and breast MRI cannot. So you always want to start with the mammogram, and if the mammogram, for example, shows dense breast tissue and you have a strong family history, then the radiologist may recommend that your doctor consider an MRI for that patient. The MRI can see through the dense breast tissue and might pick up something that would be missed on mammography. We don't do that for the routine population because the chances that that's going to occur are very slim. On the other hand, in patients who have a high-risk family history, we tend to be a little bit more careful, a little bit more worried that something could be hiding in that particular patient's breast, and so the MRI would be helpful. Ultrasound also does not have the screening capability that mammography has. So if you were only going to have one test, I would absolutely want it to be a mammogram. On the other hand, if a patient, for example, has a finding on the mammogram, such as an oval mass, or they feel something in the breast tissue, then in addition to the mammogram, we would perform an ultrasound to look inside of that structure and see whether it was liquid and it was a cyst, or to see if it was solid and if anything further needed to be done. So mammography is best to help us identify the lesion. Ultrasound might be used to help us characterize what's inside that lesion.